Good evening, all, and welcome to today's ASHA Lecture Series number 9, that is Lifestyle Medicine for Professional Stress and Doctors. Today's demanding medical profession, where stress and burnout are increasingly common. ASHA stands for as a symbol of compassion, unity, and hope, and encourages professional wellness among doctors. I'm directly going to the topic that is, I invite Dr. Arun to say this brief note on ASHA. Dr. Arun Kishore is a consultant psychiatrist in the UK, and it is ASHA is his brainchild. He is constantly working on it to improve. Then I invite Arun to give an overview of ASHA.
Thank you, Shubhada. Firstly, Ashoka has very kindly said that I'm the founder of ASHA. She is a co-founder, and we have other people here who have been with us in this journey. ASHA is Accept Support, Help Another. It's a support group. It's a voluntary organization, and we have this principle that we'd like to increase the narrative, the discussion around doctors' professional stress in Kerala and in India. There's very little that is said about this, though there's a lot of research done on it. We have been conducting a series of lectures, and this is the 9th lecture of the series. We also have a website. We have a WhatsApp presence, a Facebook presence, and one on Instagram as well. We hope to be kickstarting a few programs and to work with the IMA on bringing these into fruition. And we are very honored to have stalwarts from the IMA here today, Dr. Menon, Dr. Gopi Kumar. Dr. Menon is the current president of the IMA. Dr. Gopi Kumar is the incoming president of the IMA. We have Alfred Samuel, we have Dr. Sudarshan, all of whom are very intimately associated with the IMA. And this is not to forget Ashoka, who was the chairperson of the Women's IMA Committee. So thank you, Ashoka, and welcome to all of you.
Thank you, Arun. Next is welcome speech. It gives me immense pleasure to extend a warm welcome to you all. Today's session is indeed a special, as we are privileged to have among us distinguished personalities, Dr. M.N.Menon, State President, IMA Kerala State Branch as chief guest, our speaker, Dr. Shubhada Suri from UK. I warmly welcome our respected chief guest, Dr. M.N.Menon, whose leadership and vision and dedication inspire our doctors across the state. Sir, your presence adds great value and dignity to the occasion. I also extend gracious welcome to our eminent speaker, Dr. Shubhada Suri, physician and GP in UK. Madam, we are honored to have you here and looking forward to your valuable insights and expertise. I welcome Dr. Sanjay also, and a warm welcome as well to all the dignitaries, Dr. Gopi, Dr. Sudarshan, and all the participants, the colleagues and participants gathered here from different places. Your presence and participation make this program meaningful and successful. Welcome you all once again.
Thank you, Asuka.
Now I invite Dr. M.N.Menon, State President, Kerala State Branch, for the inaugural speech. I'll introduce Dr. Menon. It is my privilege to introduce our distinguished leader of IMA Kerala State. He is an alumnus of Government Medical College Kottayam and Government Medical College Dibrugarh. Dr. Menon has been a dedicated general practitioner for over 4 decades, serving at his own Aishwarya Clinic and Nursing Home, Srimul Nagaram, Alva. He is a life member of Indian Medical Association and several other professional bodies and has led key posts in IMA at branch, district, state, and national levels, including IMA State Vice President, Treasurer, Joint Secretary, and National Convener of Standing Committee for Ethics. Notably, Dr. Menon led the State Action Committee Against Hospital Violence, pioneering Kerala's first ever protocol for its prevention of violence against medical professionals and hospitals, and has added over 5,000 new members through his leadership in membership promotion. He is a recipient of numerous honors, including IMA CGP Best Family Doctor Award and State President's Appreciation Awards, recognizing his exemplary service and unwavering commitment to the medical fraternity. Beyond the profession, Dr. Menon is deeply involved in community health initiatives, organizing medical and blood donation camps, and promoting public health awareness. He born in Cheranallur and now settled in Srimulanagaram. He is supported by his wife Prema and their son Pramod. Over to you, sir, for the inaugural speech.
Thank you for the introduction, Dr. Shubhada. Very good evening, everyone. I consider this a great privilege to be part of this ASHA series of lectures on this virtual platform, especially in the company of a galaxy of medical experts from all over the world, many from Kerala as well, and others from India, who are committed to the well-being of the healers and the mankind as well. Let me, at the very outset, thank Dr. Arun Kishore, Dr. Ashok and others for inviting me for this function, for this program, this session, and to requesting me to inaugurate this session. It's a great honor for me. And I'm happy to note that there are several leaders from Kerala IMA who are present here. I appreciate the vision of Dr. Arun Kishore, the mastermind behind this meaningful venture, and his teammates, including Ashok Valsala, who is also a co-founder of this project. And coming to my position, I represent IMA, the largest organization of modern medicine doctors, with nearly 4 lakh membership at national level. And in Kerala, we just touched 50,000. That's a landmark for us here. We just celebrated it a few days back. And we are the second largest branch in India now. Not only in number, even otherwise, we have some significant roles at national level also. And, apart from helping our members and their families through various security schemes, professional protection scheme, etc., we are very much committed to the cause of public health. As you probably know, IMAGE, the IMA Goes Eco-Friendly, is our flagship project where we take care of the biomedical waste from the entire Kerala state and scientifically dispose it at our plant in Palakkad. Even during the COVID pandemic days, when the government was actually confused what to do, we volunteered to take up the COVID waste as well, and we managed it free of cost. That is our commitment to the society. We have various social security schemes, 1, 2, 3. If you're a member of that scheme, your bereaved family, in case of your demise, they will get nearly 1 crore. And we have got the professional protection scheme where we take care of the professional matters of the members like litigation and etc. We have a health scheme which is also supporting the doctors and the family members also in case you fall sick. Other schemes are like disability support scheme, pension scheme. A lot of schemes are there. We have got the Junior Doctors Network, Medical Students Network, and the WIMA, the Women in IMA, of which Ashok Valsala was the chairperson last year. And let me tell you that my theme for the year is actually empowering the healer, advancing healthcare. That is the IMA Kerala State branch theme for the year. My idea was something similar to what you were talking about. Empowering the healers, the doctors, through not only updating their scientific knowledge and they're giving scientific updates on these various issues and topics, but also taking care of their physical health, mental health, reminding them about the important numbers of health indices which they should know. Then regarding their physical activity, relaxation, mainly the work-life balance. As you all know, that should be the the agenda of your programs as well. So, like that, I just forgot to mention about another committee in our organization, that is Helping Hands. That is actually Dr. Sudarshan, Dr. Alfred, they are part of it, and they were leading it, still leading it very beautifully. It's actually a 24/7 and 365 service to the doctors, medical students when they are in distress, especially the mental issues and anxiety and all these things. They can call, and the psychiatrists are available online every hour, anytime you call. If the first ring doesn't get your psychiatrist, then it will go to the another one. Automatically, they take care of the anxieties and worries of these doctors, and they give solutions. And it is free of service, and it is anonymous. We don't ask their names, we don't record their names or anything. We have been able to save lives in the last few years, especially last year also. I think Dr. Susan must be remembering all these things. And we have issues also. We have issues like the Clinical Establishment Act, the Consumer Protection Act, violence against hospitals, as ASHA was mentioning, that the mixopathy is creeping in to more damage to the healthcare system in Kerala, which was supposed to be a Kerala health model in the past years. When they mix up with the Unani, Siddha, Ayurveda, and all these things, there is going to be detrimental issues which will affect the public at large. We are intervening all these issues. We discuss with the authorities on these matters. Now here, new ministry has taken over. We'll be meeting them also in the coming weeks. Of course, increasing incidents of violence, the litigation, the prolonged duty hours, the cyberbullying, etc., are some reasons for the depression and burnout of most of the doctors. So, as I said, the Helping Hands is here to help our doctors and students. And today we are going to listen to Dr. Shubhada Suri on lifestyle medicine and for handling the personal issues of doctors. And I like your theme: accept, support, help another. And I'm sure that today we will be having an enlightening session on the topic by Dr. Shubhada. And I know that you are eagerly waiting for that. So let me officially declare that this session is inaugurated, and I wish you a very enlightening session on the topic. Thank you very much for inviting me for this program. Jai Hind, Jai IMA.
Thank you, sir, for joining us for this program. Next is the lecture by Dr. Shubhada Suri. Dr. Shubhada trained at the BJ Medical College and Sassoon General Hospital, Pune, and completed MD in General Medicine in 1989. She practiced in India for 3 years prior to coming to UK in 1993. She did the MRCP and worked in general and elderly medicine for 10 years and then went on to qualify as a general practitioner. She retired as a GP partner and trainer in 2024. Dr. Shubhada has a special interest in lifestyle medicine. She is a member of the British Society of Lifestyle Medicine and is nearing completion of the diploma. She trained as a mindfulness teacher from the Center for Mindfulness Research and Practice, University of Bangor, Wales, and has facilitated several mindfulness courses for NHS staff and patients to reduce stress and improve well-being. She has a special interest in delivering mindfulness to people affected by cancer and their carers. Over to you, ma'am. I'm sure your thoughts and insights greatly benefit all of us. Over to you.
Before Dr. Shubhada starts, let me tell you that I may quit in between. Please bear with me. Wish you all the best, Dr. Shubhada.
Thank you very much, Dr. Menon, sir. And I feel very privileged to be here. Thank you, Dr. Arun, for giving me this opportunity. And let me start by saying that when people ask me, oh, you've lived in Britain for like so long now, more than half my life, I think I've spent in Britain now. And patients used to ask me, do you like Britain or you like India? And I said, I like Britain, but I love India. So at heart, I'm Indian, So I First, also, I want to congratulate you all for the wonderful work that you all do. I have practiced in India and I visit all the time, and I see families visiting doctors, and I see the difficult circumstances under which the Indian doctors practice. And in spite of everything, you all do a wonderful job. So that is a big kudos to you all. So I will start with sharing my slides. I thought I'll speak for about 30 minutes or so. After that, we'll have plenty of time for discussion around this topic. Okay, so lifestyle medicine for professional stress. This is a general outline. So what is lifestyle medicine? Medicine as a career, the challenges of doctors in India, health crisis in India, the 6 pillars of lifestyle medicine in medical practice. And after all this discussion, where do we go from here? Okay, so this is the definition of lifestyle medicine. It is an evidence-based discipline which aims to support patients to prevent, manage, and even reverse certain chronic conditions using supported behavior change skills and techniques to create and sustain lifestyle changes. And lifestyle medicine isn't public health, because public health focuses more on population. Lifestyle medicine focuses more on individuals and small groups. It's not a way to blame anybody or just sending people away with giving lifestyle advice. It's not an alternative or complementary medicine. It is very much evidence-based, and it's actually a fundamental part of healthcare. And it's not a way to sell excessive tests, because we don't really need many tests. What we use in lifestyle medicine are simple screening tools. So there are 3 main principles of lifestyle medicine. The first is the acknowledgement, the need for action of socio-economic determinants of health, because our health is determined by, our culture, our tradition, our past, how we are brought up, where we live, and so many other things. And the second bit of lifestyle medicine is the knowledge of the 6 pillars of lifestyle medicine. And the third is the techniques that actually help people to support and sustain these lifestyle changes. So, medicine is a stressful career. I don't need to tell you all that. Doctors work long hours, burnout rates are high. Doctors don't always recognize or seek help, which is a big problem. And this, of course, can affect patient care, relationships, and most importantly, our own health. And if we don't look after ourselves, we can't look after people around us. So it's really important for us to look after ourselves first. So this is taken from a paper from Indian Journal of Psychological Medicine, where they looked at 122 studies, and they found that amongst the challenges, the pervasive issues were occupational stress, burnout, emotional disturbances, and lifestyle-related health issues, which were exacerbated by systemic issues like long working hours, inadequate organizational support, and gender disparities. And this was compounded by poor lifestyle. However, emotional intelligence surfaced as a key factor influencing resilience and job satisfaction. And I want to tell you a personal story here. I'm from a family of engineers, so my father and my brother, both brilliant engineers. We have a strong family history of heart disease. My father had a heart attack at the age of 50, and he was in government service. However, after the heart attack, he strongly took on board all the lifestyle issues that he had. Like, he was a bit overweight, he lost weight, he started exercising regularly, going for walks. He started doing yoga every evening, and some, yoga nidra, like meditation. He started having regular diet. He cut out fatty foods and things. He went on to have a bypass, and he lived up to the age of 84, which I think is a good age. And on the other hand, my brother, who also had a heart attack at the age of 50, thought that medications and doctors will cure him, never believed in lifestyle, in spite of me, and us having lots of discussions. And sadly, his disease progressed quickly and he passed away at the age of 65. So it just brings home that lifestyle can play a big role, and it's not up to genes, because genetic risk this is research proven, genetic risk showed that 21%, it causes 21% increased risk of decreasing lifespan. So if we have a genetic risk, we can reduce our lifespan by 21%. An unfavorable lifestyle can increase our risk by 78%. However, even if we have a genetic risk, we can reduce it by up to 62% with a healthy lifestyle. So healthy lifestyle is really important. Even if we have a genetic risk, we can actually have a fairly good and a decent lifespan. And, wellness has been spoken for and looked at from a very long time. It's a modern word with ancient roots. We have our Ayurvedic tradition. We started in 3000 to 1500 BC, and it's a holistic system to create harmony between the mind, body, and spirit. It started as an oral tradition, but was then recorded in the Vedic texts, our sacred 4 Vedic texts. The traditional Chinese medicine also comes from a long, similar times back with acupuncture, herbal medicine, qigong, and tai chi. And we all take the Hippocrates oath, don't we? At least we did. I hope we still do it when we enter medicine. And Hippocrates was the first physician who focused on prevention. He also believed that disease is a product of diet, lifestyle, and environmental factors. And in spite of all this, today we are in the midst of a global health crisis with tsunami of non-communicable diseases, which include heart disease, stroke, cancer, diabetes, and chronic lung disease, and is responsible for 74% of all deaths worldwide. And more than 75% of all non-communicable disease deaths and 86% of premature deaths, so those occurring below the age of 70, occur in low and middle-income countries like India.
Monday, മാവിന് ചക്കപ്പ ഞാൻ ട്യൂസ്ഡേ വരാം.
Sorry, I'm just going to...
Please mute all of you.
Yeah. Okay, thank you, Asuka. Yeah. Okay, and let's look at India's health crisis. So India has a dual burden of infectious diseases as well as non-communicable diseases. The NCDs are responsible for 63% of deaths, and they're projected to rise to 75% by 2030. We know we've got diabetes, hypertension, obesity on the rise. Numbers of 77 million of diabetics are going to rise to 34 million in 2045. 1 in 4 Indians has a risk of dying from NCD before the age of 70. They occur a decade earlier when compared to overall global scenario in India. And importantly, we know quality of life suffers after the onset of chronic disease. So why is this happening? So a lot of this is linked to modifiable risk factors, which are poor dietary habits, sedentary behavior, stress, and inadequate sleep. We know chronic sleep deprivation and escalation of stress leads to metabolic disorders and mental health challenges, leading to premature mortality and disability, particularly in adults aged 30 to 70. And we start attacking stuff when people present to us with diseases, and in ourselves as well. When somebody gets diagnosed with heart problem, suddenly they start looking at lifestyle. And I think if we are a bit more aware, then we start looking at, our BMIs, blood pressures, lipids, blood sugars a little bit earlier when we reach maybe 50s or 60s. However, these are the lifestyle factors which, if we don't work on them, are going to lead to this. So why don't we start working on this here? And also these are the upstream factors which are responsible and leading to all this. So absolutely right. We've got the environment, political factors, socioeconomic factors, cultural factors, which all have an impact on our health. So these are what are called the upstream socioeconomic determinants. And I think things should be tackled right here. Totally agree. And those of us doctors who got influence, political influence, have got the abilities, have got the motivation and influence there, should definitely start working on things there. However, each one of us can start working here on the life and behavioral determinants, starting with ourselves and then other people. So That's for governments, local councils, town planners, employers, community groups. The lifestyle behavioral factors are for public health, population health, and for us, for each doctor as lifestyle medicine. And then before we go down to medications and surgery. So this health crisis in Indian doctors, and it's just not Indian doctors, we are talking about Indian doctors, so that's why I put Indian doctors, but the crisis is both a symptom of and a direct contributor to the broader Indian healthcare crisis. So, we are leaders in healthcare, and I think we all have a part to play in this. But everything is not doom and gloom. We've got wonderful work which is going on. So, let us learn about it, let us educate ourselves about it, and let us play a part in, reducing this tsunami of NCDs, looking after ourselves, looking after our patients, our communities, our nation, and global health. So this World Lifestyle Medicine Organization was founded in February 1923 with representatives from 22 countries, and it is a growing organization. The American Lifestyle Medicine was established in 2003, the British Lifestyle Medicine in 2016, closely followed by the Indian Lifestyle Medicine Society in 2018. So this is just a figure to show all the dark green are the areas of the sister global organizations all over the world. And so this is where is the ISLM, the Indian Society of Lifestyle Medicine, and that is the BSLM, British Society of Lifestyle Medicine. And here we have the American Society of Lifestyle Medicine and, all the other societies. So together, let us join hands and work on this important thing. And these are the 6 pillars of lifestyle medicine. And they are all intricately related to each other. We can't be mentally well if we don't have healthy relationships, if we are not physically active, if we don't sleep well, or if we don't eat well, or if we are drinking and smoking. So they're all linked. So it's really important that we address everything when we want to keep ourselves mentally well. So mental well-being, personal activation, empowerment, and resilience. So practices such as yoga and mindfulness, integral to India's heritage, have proven efficacy in reducing cortisol levels and enhancing mental resilience. And we are going to learn about mindfulness in our next lecture next month. Healthy relationships, so strong social connections, healthy and meaningful relationships mitigate the risk of depression and anxiety, non-adherence to medical regimes, thereby fostering better health outcomes. Regular exercise reduces the risk of all-cause mortality by up to 30%, and figures show that only 10% of Indians meet the WHO recommended 150-minute of moderate activity per week. So this is what is recommended. So at least 150 minutes of moderate intensity activity. What do we mean by moderate intensity activity? Moderate intensity activity basically means where you are breathing fast, but you can talk, but you can't sing. Simple definition. And what is vigorous intense activity is where you're breathing fast and you cannot sing and you cannot talk either. So we have difficulty talking as well. So that is vigorous intensity. We should also combine with building strength on at least 2 days of the week. We should minimize our sedentary time, and older adults especially should concentrate on improving their balance as well, at least twice a week. So let us stop being sedentary. Let us try and move about, get standing desks, and whatever else we can think of. Diet and nutrition. So predominantly plant-based diet, rich in whole grains, legumes, fruits, vegetables, reduces cardiovascular mortality by 20% and type 2 diabetes by 30%. So let's base our diet around multicolored plants, adequate protein, adequate hydration, high fiber foods, reduction in ultra-processed foods. We already spoke about how chronic sleep deprivation can lead to metabolic problems. So research shows 93% of Indians suffer from sleep deprivation, which exacerbates obesity, diabetes, and cardiovascular diseases. Let us optimize our sleep environment, sleep efficacy, sleep schedule. Let us start putting our online stuff, our screens off at least an hour before we sleep. Avoiding harmful substances. Tobacco use contributes to 1 million deaths annually in India. while harmful alcohol consumption is a significant driver of liver diseases and cancers. Let us identify the perpetuating factors, barriers, the causes, and engage with cessation services if need be. And let's also be aware of other harmful substances, such as microplastics. There's so much plastic use. Everybody drinks from plastic bottles. Everybody buys water all over from plastic bottles. Even if they are BPA free, there are still microplastics entering into that. And microplastics is just one example, but there are also, fertilizers which are used from the vegetables, the fruit that we eat. So there are lots of harmful substances in the around. There are also harmful substances that are put into, the food that we eat. Especially if we are buying foods, there are, all the E numbers that you see. They are not great for our health and have got a lot of consequences. So let us be more aware of that and see how we can cut down on all these things. Let us use nature, which is a healer, by engaging with outdoors. And lifestyle also has an effect on our gene expression. We can modulate our genes, which is known as epigenetics. So things like, stress and sleep can affect, which genes are switched on and which are switched off. Research also shows that even cancer recurrence can be reduced with a good lifestyle. Not only prevented, that we know, but even reversed, or even, recurrence can be reduced. The other thing is the microbiome, on which a lot of research is going on. So we are what we eat. Our microbiome is connected with our immune system. Our gut microbiome is connected with our brain health, with our mood. So it's really important to eat well. And lifestyle is also closely linked to mitochondrial functions. So the regeneration and degeneration of mitochondria depends and is related to our lifestyle. Immune system is related to that. And let's remember, we probably advise patients to exercise and eat well and etc. But lifestyle medicine is for us too. We owe it to our patients. We owe it to our families. We owe it to our nation, and we also owe it to global health to look after ourselves. And most importantly, we owe it to us. You can't pour from an empty cup, and we can't look after other people if we don't look after ourselves. We should use it in our medical practice. We should help people to, and support them with lifestyle interventions before we go to the more risky interventions like surgery. Let's give them more options. 90% research shows 90% of patients express preference of lifestyle over medications. And we also know that doctors who practice lifestyle medicine are more likely to advise people about lifestyle changes. And coming to lifestyle medicine and climate, so having a good lifestyle is a win-win all over. The lifestyle behaviors that cause chronic diseases are often the same ones driving climate change. For example, we now know that meat production is not good for the climate, and lifestyle medicine also advises us to have a more plant-based diet. So lifestyle medicine, in its own way, helps with climate change. Climate change directly threatens human health. So lifestyle medicine offers multi-solving solutions that treat illness while actively lowering greenhouse gas emissions. So let us be the change that we wish to see in the world, as told by Gandhiji. Let us start with ourselves first. And last thing I want to request you all is to look at all the 6 pillars, and let us have 5 minutes. I think we have got a bit more time. So maybe a few minutes when we all look at each of these pillars in our own lives, because I believe that we are experts in our own life. And so let's give a number from, say, 0 to 5 of where we think our mental well-being is and where we want it to be. And one simple change which we can sustain to make it better. And same with each of these. How is our physical activity now? 0 to 5. So maybe you're doing 2 and we want to be maybe at 4. How are we going to do it, starting today? And, changes come slowly. Changes will come. We have to sustain them. And I think we also have to discuss these things with our families, because we can't do it alone. So involve your family, involve your community, and let us all fight the NCDs and make ourselves healthier and make our people around us and our patients and our nation healthier. So let's have 5 minutes for this, and then we can all come together and we can have discussions. So that's really all I wanted to say. So I'm going to, as soon as you've written this, you can, if you have a pen and paper, you can do it on pen and paper, or you can also just do it on your mobile phone, just putting a number of where you are with each of these, and where do you want to be, and one change, maybe one simple change. It doesn't have to be anything very big, and it's got to be something that you think you can sustain or you can actually do. So uh, so many things, that little things, and you don't need a lot of time for a lot of these, like putting your screens off an hour before sleeping, maybe stopping eating, or adding refined sugar to foods, uh, and maybe with physical activity, what I did was I bought a standing desk, so that I wasn't sedentary and sitting all the time. So I could kind of stand on my toes, or do some movement while I was standing. Um, Healthy relationships. I decided every month I would ring one friend or one person who I had a relationship with, who I hadn't contacted for a long time, and so on. So there's lots we can do. So if we want to all have a look at this for ourselves, and we will come back after that onto the discussion. All the references that I've used in this are on the last slide, and a lot of it is from British Society of Lifestyle Medicine, Indian Society of Lifestyle Medicine, and the various journals, the World Health Organization. So they're all very standard and known references. So is that okay, Dr. Arun? We'll have a few minutes and then we can all come back together for discussion. Yes.
Certainly.
Dr. Arun?
Yes.
Can I just have 2 minutes, because I will leave before 9.
Yes, please.
Of course.
Yeah, this is a very lucid presentation, really enlightening. Let me add one more point, like they say mental health, being, ventilation, physical activity, everything is done. But we should find time. We are just, most of the doctors are totally, so to say, always involved in medical practice and patients and private practice, everything. I don't know what is the private practice there in UK. But here, after their regular duties, they go for their clinics and sit up to 9 o'clock seeing patients and making money. They don't have time for their family. They don't have time for their friends. There are people like that. They just keep on practicing without sparing time to take care of their own health and the health of the family members. I strongly advise that they should have some relaxation. Definitely, they should find time to spend with their families. They should go for vacations. They should try to nurture their inborn talents like singing, writing, and other activities, painting, all these things. This happened during the COVID times. Many of the doctors have found their inborn talents. So that is one thing, one way which we can relax and bring down our stress. And as you said, unnecessarily working too many hours, sacrificing your sleep and peace of mind is not doing anything good. So we have to introspect and correct ourselves first, because we give these advices to our patients. You go for a walking, you run, you play, yes, you swim, everything. Another thing which we find here is that we ask our patients to go for walking, but where is the place for walking? I used to tell the local administrative body to have some parks and walkways for the people, so that they will not be hit by the vehicles that is just flying through these narrow roads and all. So there are a lot of things which can happen. And immunization is also another part which is not lifestyle, but I am telling you, there are many doctors after the age of say 40, 50 with comorbidities. They should go for adult immunization. I am implementing it here in this year. I am implementing it. Most of the branches are doing it, especially the flu shot, pneumococcal vaccine. The current pneumococcal vaccine is a single shot. Then the all other vaccines, hepatitis B, hepatitis A, the varicella, then again the current HPV vaccine. HPV vaccine is the central government has given it free for all the girls here, but I think everyone may not be covered there. So these are the things we are adding to, because I have a special committee for health of the doctors and families, and we are trying to implement these things here. Take care of your own health, not just the health of your patients. That is what we are trying to do here. I don't know how successful I will be, but it will be an ongoing process. I think Gobi will continue it next year. And by the way, I think we'll discuss your activities among ourselves and find time to or a plan to associate with you also, Dr. Arun. So on that note, may I take leave? Thank you for inviting me here. Good night to everyone.
Thank you, Dr. Arun. Thank you for your valuable advice and for all the wonderful work that you're doing. Very
Good night,
impressive.
everyone. Thank you.
Thank you.
Thank you, sir. Good night.
Shubhada, we can continue to the discussion.
Yeah, no questions in chat box. You can
Yes,
directly discuss.
We can,
with,
I will let you do that, Soka. So I just wanted to, just one more thing was, so the, so these are all the references that were used, and thank you all very much for patiently listening, and we are all open for discussion now. Yes, thank you.
Self-care is very important, and it is not selfishness. Everybody says it is not a luxury, it is a necessity. That is what I want to say. As Dr. Menon said, we don't get time to do all these things. We can advise patients very well, but it is very difficult to implement in our case. That is the problem here. The private practice is a problem. Evening.
And sometimes people only start doing it when they themselves end up with a heart attack or
Then only
diabetes. Yes. When it is like, the horse has bolted really that time. Yes. And then we are shutting the gate. So I think really, really important. I mean, there are very many small things that, we can do. It doesn't have to be all time consuming, going to the gym for hours, nothing like that. Like when I was working, I started, getting up and walking every time to call the patient rather than buzzing for the patient, just walking to the waiting area, coming back. Like I said, I started using a standing desk. I started taking a steel bottle with water rather than using a plastic bottle. I stopped buying all, processed foods as much as I could. Stopped using refined sugars in the desserts. I started using things like dates or, fruits in, to make desserts rather than, putting sugars, which is really, detrimental for our health. So there are many little things that, we can do. And we are, like we said, we can, we all know how our life is and what we can manage. And I think it's also important to do these changes which will be sustainable. And, taking the family with you is really good, because then you can remind each other, about these things. So, that's what my kind of humble suggestions would be.
Dr. Sanjay, anything to add?
Thank you, Dr. Ashoka. I mean, it's a very important topic and very, very timely to have this discussion. My thoughts were about what kind of an approach would help to raise awareness of these issues among Indian doctors, because I think we cannot automatically translate the approach that we use in the UK. I mean, lifestyle issues are a problem everywhere, and doctors looking after themselves is a big problem. But the approach that we need in India may be different from what is being suggested in the UK. So I just wondered whether there were any thoughts about that kind of, because simply, I mean, everybody knows that, the lifestyle factors are important and they can affect our health. But I mean, you mentioned something about time, but I think people feel that they don't have time. But sometimes it's just raising awareness about that there is time. It's just about where you focus the time, isn't it? So just a question.
So I think we have two people in the audience, if I'm not mistaken, who have written a book about this. We have Dr. Atulya Shogan, and
Yes.
if I'm not mistaken, is Dr. Rajiv here as well. Atulya, please.
Thank you, sir. Thank you, sir, for inviting and sharing us a link. Happy to be listening to the talk. It was a nice talk, ma'am.
Thank you, Atulya. Thank you.
Your
And
definition is
yes, I look forward to reading your book. Yes, yeah. If you put the link in that, yes.
fine, ma'am.
In fact, Atulya and Dr. Rajiv have written a book which I will display here. Sorry, I will make sure that my camera is not blurred so that you can see the.
Yeah, just see. Healing the Healer.
Mm-hmm.
Put it in
Thank you.
details in the ASHA so that we can have the book.
Yes. So, Atulya, would you like to say something, or if Rajiv is here?
Yeah, yes, sir. Yeah, ma'am, this book actually the concept was Rajiv sir's though. We had thought of writing this book which introduces yoga, basically yoga. They were for undergraduates, medical graduates, basically. So it integrates the postures in the yoga which can be easily followed with the anatomical correlation with each of those yoga postures. It also talks about mindfulness a bit and the role of lifestyle medicine which needs to be adopted by the students, medical students. So once they know that these things are important in life, they start experiencing this as a first year student, like as an undergraduate student. When you start using or adapting these things, they know how it will be useful, and then when they master it, probably they can advocate that to their patients. So that was the concept of writing this, and we thought of making it very simple for these students so that they can read the book, and with the help of pictures they can follow some of these yoga techniques. That was the main concept. We thought we would introduce you to medical students this, and then first year students, so that they can correlate with the anatomy and then learn it, and they follow this. So that was the concept of writing this.
Thank you, Atulya, for that. It seems like a wonderful piece of work, and I really look forward to reading it. And I think yes, that's how we all have to work really to make people aware of this, and everybody, and empower people to do it. And starting with younger generation is always good, because they are the future generation, and if they believe in it, probably they're going to teach their kids as well, and they're going to tell their patients as well. So I think it needs to start from schools, really, all these lifestyle changes.
Yeah,
And
yeah, ma'am. Yeah, exactly as you said, ma'am. See, the realization would come, the benefit would come only when they start realizing that they experience the benefit of whatever we project to them, and then they start experiencing it. They feel they get de-stressed with all these things. Probably they would start using it for, or rather advocate that for others. So that
yes,
experiencing themselves and feeling the goodness of it is very important to preach and practice it. So,
thank you.
I think Sanjay was trying to say something.
Yes.
Yeah, thank you, Arun. And that's a really wonderful title for a book. I just think it's so apt that, as healers, we don't think about our own healing or our need to heal. I was just going to ask a question really, and I just wondered whether how familiar do you think the doctors in India are with health coaching? Because the coaching approach leaves it kind of empowers the individual to look after their own health. Because we know that through a lot of research around behavior change, that simply, I mean, most doctors know, I mean, the knowledge is there, but there is a big gap between the knowledge about what is good for them and the actual implementation or the actual behavior change. So I just wondered whether I just wanted to get a sense, because I don't practice in India, to get a sense of is there an awareness around coaching as a technique, which means that the person sets their own goals and they decide that this is what I am going to do, not try to do, but going to do. So I just wanted to get a sense of that, if any of the colleagues would be able to help with that. Thank you.
So I don't think people or other students, because I am from medical college. I'm an assistant, working as assistant professor here. So seeing students, I don't think, sir, like students do really have that inclination for getting themselves coached for all these kind of lifestyle medicine, or unless we teach them and show them, or rather make them feel that this is good. The acceptance of this would come only when they start realizing it. So I think as a bit of knowledge is always needed, but along with that, the practice also is needed. So introducing this and making them practice and feel what the actual benefit, probably with that they would start adopting this in their own life, and they would preach it to their patients for
Yeah,
their
it's
coming generation.
excellent. Yeah, no, it's a really good initiative. It's an excellent initiative. Thank you.
And I think while I was reading, I came across that in India, the suicide rate and the stress is highest in doctors less than 30 years of age. So I think that's great work you're doing, Atulya, in that field, yeah, at that age, yeah.
I think Dr. Asha Warrior, Asha, would you like to comment directly or tell us what your thoughts were?
Hello, everyone. I'm Dr. Asha Warrior. Thank you for that wonderful talk on lifestyle medicine. I think it is, as you said, there may be 90% of the public not aware of lifestyle medicine, and I would say 99% of the doctors not. I wouldn't say aware, but 99% are not giving adequate importance for their lifestyle, is what we think, because a lot of lifestyle talks go on in the public, but then see in this doctors group we have so few participants for such an important topic. I would say for scientific sessions you get much more attendance. That is the importance people give to that, and that awareness should be I think spread more. And I look forward to your sessions, beautiful sessions on these ASHA nowadays. And it happens to be my name too, in the group that you've given. And when the topic on coaching came in, I just got it. I'm a certified coach, actually. I've done this thing on WellG, NBHC certified coach. But then, it sounds quite useless when I use it on people here, because coaching needs that evolved mind to understand. I mean, to what do you say, find the solutions themselves. In counseling, we just give them advices, right? In coaching, you need them to analyze themselves and find the solutions for themselves, which I think many are not yet mature enough to do that. In the Western world, it's quite popular now, but in India, it's just catching up, I think. But that would be ideal in a what is an educated mind, because solutions can come only from within. Nobody else can give you a solution, because what fits one person doesn't fit another person. Just because the coaching topic came in, I just put in a comment. That's all. Thank you for giving me this opportunity. Thank you, Dr. Erin Kishore, Ashoka ma'am, and the speaker Shubhada ma'am. Wonderful talk.
Thank you.
Thank you.
Thank you, Asha, and I've identified you as a potential speaker in future. you can tell us about coaching for doctors.
Yeah, she used to come to branches for talk.
I
She
go
is
to
the
branch for yeah.
convener for the communication skills.
Wonderful.
We are all trainers.
Good, good. So Asha, you can tell us about coaching and communication.
Yeah, she
in the
is a
future.
convener.
Thank
So
you.
many are trained by a person from Asha. That madam's name I forgot.
Indu Anuja.
Indu Arneja. She's
That is on
from
healthcare communication.
Delhi. She
That
trained
is
us.
on healthcare communication. Yes. The other one I was talking about was coaching, wellness coaching.
Wellness coaching.
Yes.
Anybody else who would like to comment or tell us about their experiences? Ashok, I think we are sort of coming to the end of our time. Okay.
If there is no more questions, we'll go on to the last part. Dr. Alfred, vote of thanks.
Hello, everybody. Dr. Arun, Dr. Shubhada Suri, Dr. Ashoka, and dear friends. Today we had the 9th series, and it was really an excellent and relevant topic. And Dr. Shubhada Suri presented an all-inclusive talk on lifestyle medicine. Now, as discussed, now hereafter, health and wellness coaches centers, coaching centers may come up in a large scale. And we have to take care of ourselves. We have to love ourselves. We have to take care of our well-being, our mental health, and our physical health. And that is the message. Thank you, Dr. Shubhada Suri, for your presence and excellent talk. Thank you.
Thank you, everyone, and thank you for inviting me.
Okay, well.
Thank you, Arun.
Special thanks to Dr. M.N.Menon, IMA State President, for his presence and inaugurating the session. I also thank Dr. Gobi Kumar, Vice President and President-elect of IMA Kerala State, for his presence. I thank all the members of ASHA and all other participants for the presence, participation, and I thank you all. Bye. Over to Arun.
Bye, everyone. So I think we're coming to the end of our session today. Thank you, Shubhada. Thanks for the...
Thank you very much. Thank you, Ashoka, as well, for...
Thank you all.
Once
again.
Thank you.
Bye.
Good night.
Thank you, everyone, for patiently listening.
Thank you.
Good night. Good night.
Bye-bye.
Thank you. Thank you.
Tomorrow onwards, we will practice your pillars of lifestyle. Thank you.
One little change every year.
Yeah.
That is that is to be sustained. Yes.
We'll find time little for any one of these pillars.
Okay. All the 6 pillars, we have ranked all the 6 pillars, and we will improve our rankings.
Okay. Very good.
Thank you, Arun, for giving me this opportunity to chair the session. Thank you all.
Bye, Arun. Good night.
Good night. Good night.
Thank you. Bye-bye, everybody.